Welcome everyone. Thank you for joining today's focus group discussion on HIV molecular cluster detection. This presentation will give us some info on how these new tools help us find and fight HIV. These are the terms we will be referring to throughout this presentation. HIV, a virus that weakens the body's defenses. Drug resistance testing, a test that doctors use to see if the strain of HIV is resistant to certain medicines. HIV network or cluster, a group in which HIV is transmitting quickly. HIV strain, the specific type of HIV virus someone has. Molecular cluster detection, a tool that health departments use to find groups where HIV strains are transmitting fast. In the US, HIV affects some groups more than others, like people of color, men who have sex with men, people who use drugs, sex workers, transgender people, and people experiencing financial hardships or homelessness. Health officials are working hard to stop HIV. One part of their plan, ending the HIV epidemic in the US, has a fourth pillar called Respond. Respond is about quickly identifying groups of new HIV cases and helping them get the right help and treatment they need. They use methods such as molecular cluster detection to find networks where HIV is transmitted rapidly. Let's start with how we get data for HIV cluster detection. When someone is diagnosed with HIV, their doctor requests a variety of tests, including drug resistance testing to check which medications will work best. These tests go to the lab, and through drug resistance testing, we obtain details about the specific strain of HIV. Results are given back to the doctor to guide treatment. They are also safely shared with health departments. Health departments use this information to watch trends and analyze if HIV strains are too similar to one another, which could indicate rapid HIV transmission and require a quick response. Talking about how HIV is transmitted on a tiny level is important. It helps health officials to know how and where rapid HIV transmission is happening and when there are sudden increases in new cases. This information helps public health officials make good plans to treat, control, and stop further transmission. Public health officials also connect people living with HIV with resources like treatment and counseling to help them live healthier lives. As mentioned, when a group of people have almost the same type of HIV, it means the virus is spreading fast. In Georgia, if 4 or more people are diagnosed with very similar types of HIV within a year, they are considered a cluster or network. Health workers then start to wonder, why is this group getting HIV so quickly? What help is missing? Is everyone in this group getting the help they need? Can we possibly reach their sexual partners to offer resources to test, treat, or prevent HIV? A cluster indicates there are significant gaps in HIV treatment and prevention within a group. Cluster detection guides us in prioritizing resources where they are needed most. By always watching and checking, better plans can be made to respond effectively, helping lower HIV transmission and giving more support to affected communities. It's crucial to act fast when dealing with HIV clusters because the rate of HIV transmission in these groups is at least 8 to 11 times higher than the national average. These clusters play a big role in future HIV transmission, so quick action is needed to stop it. There are a few things we need to keep in mind. The tools health departments use cannot tell us who passed HIV to whom. They just show that certain people share the same virus type. We also cannot be sure that one person directly gave HIV to another, as there could be another person involved who has not been diagnosed, or we don't have their HIV data. The Centers for Disease Control and Prevention advises against using these or similar tools or trying to figure out who passed HIV to whom, as it doesn't really help with public health efforts. Health departments keep HIV data safe by using strong security measures. They make the data anonymous and control who can access it. They remove personal info like names and addresses and only allow certain people to see the data. They follow laws like HIPAA and handle the data ethically to make it private. Health departments also train their staff regularly and record who accesses the data to ensure it stays safe and confidential. With these public health data, we can better understand health issues in our community, allowing us to make informed decisions, create supportive policies, and take actions that keep everyone healthy and safe. I will now give you some examples. In 2016, the head doctor at a small clinic in Lawrence, Massachusetts, diagnosed 5 people with new HIV. All used injection drugs. A deeper look using molecular cluster detection revealed a larger group of 184 people with HIV. Many found out they had it during the investigation. This finding caused big changes. The clinic started offering more services like addiction treatment, easy access to HIV prevention, online and street health checkups, and help with housing. Changes in laws allowed officials to open more help centers for people struggling with substances, and more than $1 million was allocated that year to help stop HIV. In 2021, in Detroit, Michigan, a network of transgender women of color was identified through molecular cluster detection. Through discussions with the affected communities, it was found that there were big gaps in health services for transgender adults. They didn't have enough access to care that respects their gender identity, sexual health, and wellness services. To address this, the Pull-Up Project was started. It offers mobile services that include care tailored for transgender people, sexual health services, testing for HIV and STIs, vaccines, a food pantry, and help with transportation and housing. In Georgia, experts noticed that HIV was spreading fast in 5 groups, especially among young Hispanic and Latino men. Local health workers teamed up with the CDC and community groups to figure out what was going on. They talked to lots of people and found out it was hard for some to get healthcare and support. They found out there weren't enough Spanish-speaking health workers, not much HIV info was given in Spanish, and people found the US healthcare system hard to navigate. So university researchers and public health officials worked together to get more HIV messages out in Spanish and set up a new job for a person who speaks both Spanish and English to help guide people through the health system in Atlanta. This has helped connect over 200 people to health info and services in Spanish. Finally, last year, public health officials found a group of at least 19 people in Georgia, from Atlanta to Savannah, who all had a similar type of HIV. Most of them were young Black adults, and almost half were women. The group kept getting bigger, and they tried to talk to everyone in it to offer necessary services to them and their partners, but they could only reach about half of them. This shows that we need to do a better job of reaching out to these women in a way that respects their culture, so we can give them and other women in similar situations the help they need. So basically, HIV molecular cluster detection helps health officials find communities that aren't getting enough support to prevent HIV and to connect them to other important services. By finding these groups of HIV cases early, health departments can act quickly to prevent further HIV transmission.